Our baby is going to be named Nelly Inez. She's due April 17th.
And our baby's due May 7th. And his name is Peter Kevin Spackman.
Good evening. My name is Kim, and I am a registered nurse and a lactation consultant. So I work mainly down on the mom-baby unit, so you get to see me after you've had the baby. I get to give you the tour tonight, and I'm glad you're all here. Are you ready?
Yeah.
You're going to come to this desk right here. Monday through Friday from 6 a.m. to 10 p.m. There's somebody at this desk. They will be here to admit you and welcome you to the hospital. If you come in during the middle of the night or on the weekend, there's nobody at the desk, pick up the phone. It calls the unit secretary in the labor area, and they come out and they get you and take you in and help get you all admitted in there.
So it just automatically makes the call?
Mm-hmm. It automatically calls. Okay, so you don't have to worry about a number. This is standard protocol for all hospitals across the nation that have babies. It's locked coming in and it's locked going out. When you're leaving, then you let the unit secretary know that you're leaving and they'll let you out. When you come in labor, they're going to take you first to an exam room. This is just where we do mainly triage. We hook you up to the fetal heart monitor. Do you all know what the fetal heart monitor is? Yes, it's got the two belts that go around the stomach. The top belt measures your contractions and the bottom belt measures the baby's heartbeat. Then we compare the baby's heartbeat to the contractions, and it lets us know how the baby is handling labor. We'll hook you up to the fetal heart monitor in here, see how far you've dilated. Then we contact the doctor and let the doctor know how you're doing. The doctor then makes the decision about whether or not to admit you. He might say, send her home and let her walk a little bit, or we might say, let's admit you and let you have a baby. From here, they'll probably just have you walk to your delivery room. This is where you'll labor and you'll deliver and have the baby. We hope that you're going to be up walking, up moving around. That helps labor to progress faster. We try to do things that help ease the labor pain. Walking is one of them. We do have a jacuzzi bath. If water feels good to you or sounds good to you, you can get in the bathtub. If the shower sounds good to you, we actually had a woman once, we laid blankets down on the bottom of the shower, and she laid on the floor of the shower because that's what felt good to her. We'll do what feels good for you. We've got birthing balls also. You can sit on the birthing balls, you can lean over the birthing balls, whatever feels good to you. And we also have epidurals if that's what feels good. You'll be on the fetal heart monitor in here, the same as in the exam room. When it gets close to delivery, then depending upon your doctor or your midwife, they each have a preference. They might stand just beside the bed and catch the baby as the baby comes out. Or the bed breaks down about right here, the cushion comes off, the bottom part of the bed slides underneath, and stirrups come up and you put your feet in the stirrups. The doctor sits on a stool right here and catches the baby as the baby comes out. You can ask your doctor how he or she delivers. When the baby is born, we put the baby on your stomach, dry the baby off. We want the baby to stay warm. It's okay, you can get your hands in there and help dry the baby off. Generally, they look at you guys and say, do you want to cut the cord? I hope you all say yes. Be aware that the cord is kind of tough. As you're cutting the cord, it is kind of tough to cut. Once the cord is cut, then the baby is moved over to that warmer. They do a quick check on the baby. They check the heart and the lungs to make sure everything looks good. The baby sounds good. After that, they'll move the baby back to you. Now, what's skin-to-skin contact?
The best thing for you and the baby.
It truly is. We put the baby right on your chest. We keep the baby there for the first hour. During that time, hopefully the baby will breastfeed if you're planning on breastfeeding. It really is best for the baby. The baby's temperature stabilizes better, blood sugar stabilizes better, baby eats better, baby just does everything better if we have that skin-to-skin time between you and the baby. During the 2 hours after having the baby, there is kind of a recovery period. The nurses will be checking your blood pressure about every 15 minutes to a half an hour. They'll be checking the baby's temperature, checking the baby over, making sure the baby's okay. 2 hours after the baby's born, they'll ask you if you want a shower. From that point, we can move you to the mom-baby unit.
If a C-section were to need to be done, where'd that be?
Do all the prep here. in this room. Remember the hall where the exam room was? Straight down that hall are the C-section rooms. Everything is on this floor. If you have family that come with you, are waiting for you to have the baby, this is where they'll be. They're close. We let them know when you've had the baby. The mom-baby unit, you'll notice that it was a lockdown unit also. This bed is a little bit more comfortable than the labor and delivery bed. Notice I said a little bit more comfortable. It's still a hospital bed. So if you need extra pillows, please let us know and we can get you extra pillows. And that makes the stay a little bit more comfortable. You're here for 24 to 48 hours after having the baby. We want the baby to room in with you. The baby is actually in the room with you through the entire stay. And that way we don't lose a baby, we don't have somebody walk out with a baby. The baby is only removed from the room twice. Both times the baby is just taken across the hall. About 12 hours after the baby's born, they'll do a hearing screening. When the baby is closer to 24 hours old, they do more screening studies on the baby. One is for jaundice, one is a metabolic screen, and one is for congenital heart disease. There's also a jacuzzi bathtub on this wing. If you've had stitches or if you've had tearing, soak in the bathtub can feel really good. 8 o'clock in the morning, noon, and at 5 p.m. there are meals. For you dads, there is the Paragon cafeteria that's just down a floor. They serve good food and for reasonable prices. We've got a nice machine and a refrigerator with drinks and things in it that you can get to in case you're hungry and you just need a little something to eat.
How soon after delivery do the moms usually can start eating?
Right after you have the baby, as soon as you feel like eating, they can get you some food.
Is that couch a pull-out bed?
Yes, it is. Not every room has a bed that big, but that does fold out into a bed. Most rooms just have a small chair that folds out into more like a cot. It'll be a little bit tougher for you, you're so tall. But we try to make you comfortable while you're here.
During the screenings that the baby's taken out, can the parents go with?
Yes.
Okay.
So you can go with the baby. We don't take you away from the baby, you can go too.
Do all these things about dad also apply to grandma, if she will be here?
Yes, they've let that happen.
Did I miss where you wash the baby? Was that last room?
When the baby's around 12 hours old.
Okay. So it'd be some point in this room.
Yeah, when you're in this room.
Okay.
Okay, so a lot of times it's done when we do the hearing screening and they'll do the bath, but we can do the bath in here where you can see the bath and take videos and pictures of the bath.
So I know you don't have a nursery. What if the mom just really needs the rest because who knows how long labor is and she just really needs a break? Is there a way where someone, if husband isn't around, to take the baby for a couple hours so mom can sleep?
Yes, and we just take the baby back to that procedure room.
Okay.
Someone will stay in there with the baby while you sleep. Most insurance companies provide breast pumps. Check with your insurance company. Some of them mail it to you after you have the baby. A lot of them will provide it right after you've had the baby, and we give you a prescription, or we can fax the prescription in, then you can go and pick up the breast pump.
If we already have it, should we bring it?
It wouldn't hurt to bring it, because we can show you how it works and you never know when we might need it. We've got some postpartum teaching that is done on the TV. The channels are posted just right above your head, right there. The postpartum teaching is channel 120, breastfeeding is 122, CPR is 124. Watch those videos. There will be some teaching done by your nurse. There'll be some forms for you, and there'll be forms for you to sign. So it takes a little bit of time. So if you're planning on leaving, watch your videos ahead of time and plan on a couple of hours to prepare for discharge. Another thing that helps is make sure you know how to use your infant car seat, because we place the baby in the car seat here in the room. It's a whole lot easier to put the baby in the car seat in the room than it is trying to do it in the car in Idaho weather. They'll give you the birth certificate when you get over here. You'll fill out that birth certificate. Hopefully you've got a name. Again, I've seen parents wanting to go home and can't go home because they don't have a name for the baby. Hopefully you've got a name all picked out. There's a page that tells you about the birth certificate and about the Social Security number. It'll give you all of those instructions, and then you'll fill out the birth certificate. When you identify to us who the baby's doctor is going to be, then we notify the baby's doctor, and he'll make rounds and check the baby before the baby goes home. The baby can't go home until the doctor's seen him. There used to be a checklist on the hospital website. I hope it's still there. Personal items for you, clothes, blankets for the baby. You don't have to bring a whole lot of things, but people do. Just bring what you're going to need to stay here for a couple of days.
From what I understand, circumcision is something the pediatrician does, not the hospital, right? For boys.
Yes, that'll be done in your doctor's office after discharge of the baby. This is the dad's corner. The ice machine, so you can get ice water. We've got a microwave, and right up here in this cupboard, we've got soups that you could warm up. We've got crackers and things up here, breads and bagels right here, and toaster right down here, jams and peanut butter, soft drinks, puddings and juices, yogurt, string cheese. Those are just some of the items that are in there. This is free for dads, just to help yourself. That's the tour of the mom-baby unit.